en 2014, nous avons reçu de la Légion royale canadienne un fonds de recherche, si vous voulez, une bourse pour les étudiants et les étudiantes canadiens et canadiennes. Cette bourse, c'était pour promouvoir l'excellence en recherche au niveau de la maîtrise.
The idea of making an investment that would last 30 or 40 years, and the idea of creating a greater base of expertise in Canada in terms of military and veterans health issues was huge from the Legion's perspective. That's how we got started with the master's program 10 years ago, and we've been delighted with it ever since in terms of the people selected and who ultimately graduate from the program. It's a tremendous investment.
I think when we think of scholarships, we think of the money component, but for me, just knowing that people who I look up to and organizations that I really value have seen the work that I do and have considered it worthwhile and worthy and important has been such a boost to my confidence and has made my research really grounded in like the understanding that it is important and is worthy of being shared and being acknowledged.
I'm so grateful for this funding, but also beyond that, for the openness to research within these groups and the kind of encouragement of research by the Legion, by CIMVR as well. And then even just in my own experience recruiting for this research, when I've talked to folks on the phone, when I've explained what we're trying to do, a lot of people have been just really enthusiastic, but also just really, really grateful that, to be a part of it.
For my honors thesis, we explored the effectiveness of an online acceptance-based behavioral treatment for chronic pain, specifically targeted for military and RCMPs, both actively serving and veterans of those forces. We did a pilot study exploring whether or not this was effective. And we found that it was quite effective for kind of decreasing a lot of psychological distress associated with chronic pain over this 8-week kind of group intervention.
From military to civilian life, there was a decade there where I was very lost, very angry, struggling with a lot of things. And what happened after that was pretty incredible, because I was given the award on stage at CIMVR. And then I was approached afterwards by someone who worked with Outward Bound Canada that does their veterans programs. And it was really interesting how much my current focus on stigma with veterans could be interlaced and tied into my other background, which was in adventure and wilderness tourism.
My supervisor, she had suggested that I look at positive mental health. Healthcare professionals, mental health care professionals, are really about, their therapies are really about targeting the symptoms of mental disorders and reducing them, when really perhaps that's not the main issue. Perhaps increasing positive mental health in patients might help them more.
Et c'est vraiment là que j'ai vu l'impact grandissant que pouvait avoir la recherche pour améliorer leur prise en charge, mais également leur avenir, parce qu'en ce moment, on n'a malheureusement pas accès à une thérapie efficace pour beaucoup de patients qui sont atteints de traumatismes crânio-cérébraux, surtout sévères.
My hypothesis was, again, I'm going to guess that there's going to be a large proportion of those who would be dealing with the long-term effects of a traumatic brain injury, so having that persistent TBI. So then we wanted to look at, from persistent TBI, what does that relationship look like with chronic pain? So we looked at 3 types of coping, wanting to see would that play a role. So we looked at problem-solving coping, avoidant coping style, and self-medication coping.
We are so lucky at CIMVR to work so closely with the Royal Canadian Legion, and the support they provide us and our students in the military veteran family space is amazing.
obviously the importance of the research, which is what the scholarship programs are all about producing from the Legion. It's one of our top initiatives, really.